I think the primary number one mistake that I see is that people tend to overcomplicate it. You may have $1 billion at your disposal. You can't biohack your way through this. In fact, the best thing to do is to get out of the way and provide your body, your placenta, your baby with the resources to just do what the body and the placenta and the baby do. So that could be adding some additional, nutrients through some of nature's multivitamins. It could be through some directed supplementation, but for the vast majority of people, getting out of the way and supporting the body through salutogenesis to do the thing it does the best is really the way to go.
Welcome to the Radical Health Rebel podcast. I'm your host, Leigh Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In this week's episode, I go deep with OBGYN Dr Nathan Riley discussing fertility, pregnancy and birthing. I first heard about Nathan's work via Paul Chek and how Nathan oversaw the birth of Paul's daughter, Zoe. Paul speaks very highly of Nathan's work, and so when Nathan reached out to me, I simply had to get him on the show. Nathan's approach is very different from the general medical approach, and as you might imagine, his patients have great success in becoming pregnant, uncomplicated pregnancies and births, and ultimately healthy babies. I really hope you enjoy Nathan's amazing knowledge and insights and experience. Nathan Riley, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Leigh Brandon, thanks for having me. It's a pleasure finally making this happen.
Yeah, it's great to have you on. So Nathan, to kick things off, could you share with the audience an overview of your background, including your journey to becoming an obstetrician and gynecologist?
Yeah, I guess the shortest version of that story that is probably hits all the highlights is, you're a smart kid, you do well in tests, why not be a doctor? And then your critical thinking skills are sort of narrowed down in that process because you're expected to just answer more and more multiple choice questions, and you're rewarded with more education. You're surrounded by more and more people that are incentivized to do well on exams. And then you somehow get into medical school. And while you're in medical school, you're studying about a textbook of, physiology or pathology every 2 weeks. I mean, it is brutal training. And then you rotate through every aspect of medicine and like all the major departments, and none of them really, I was not very enthusiastic about any of them. I was also coping with my dad being at the very end of his life at the midway point of med school. So I just don't think I was invested. There always seemed to be an answer for everything, and it seemed very unnatural to me. Like it didn't seem like I was really learning how to get people better. It didn't seem like I was really doing much to impact any sort of statistics, whether you're looking at mortality, morbidity, rates of diabetes or whatever. It just seemed like we were just like helping to accommodate what was happening. And then I discovered the sort of practice of childbirth. And as an obstetrician, what came later was that I realized it was the same issues where we were sort of trying to wrestle nature here. But when you first see a birth, you're in the room there and there's this magical thing that happens. Like this baby comes earthside and you're like, wow, like that's not a test question. Like there's something really, really special about this that seemed to sort of capture some curiosity in me. And it was also scary as hell. Like it's scary as hell to be there for a birth when you haven't seen it ever. It was just like so much. It was not a surgery. There was not really any reason to have like gone to medical school. I was just being present for this beautiful thing unfolding. And while that sounds cliche, that's what I think draws most of us doctors into certain specialties. Like there's something around working with kids or something about being able to operate, and be a surgeon, or, you understand the brain, so you want to be a neurologist. Like there's these compelling reasons. But for me, it was like, what a beautiful mystery. The beautiful mystery of childbirth. Like, wow, I want explore that. It's sort of like when you take a dose of psychedelics or something and you're like, wow, I don't know what that was, but I just can't stop thinking about that incredible experience. That was really how it felt for me. That was maybe my first psychedelic experience, if you want to call it that. And so then I decided I'll specialize as an obstetrician and gynecologist, not realizing maybe what I was getting into, which is about 70% surgical training. And then the other 30% is really treating pathology or disease in the pregnancy and childbirth and postpartum periods. That's the OB part of an OBGYN. And at the same time, I wasn't really seeing a lot of sick people. Like this person's not sick. They're pregnant. They're beautiful. Like they're powerful. Like there's a lot to this. So the mystery was still there for me, but I had to really wrestle with the reality that I was being evaluated and supervised by individuals who had long ago lost that magic, and that's not maybe any discredit to them. It's not meant to be. It's just that like when you're in doing a thing for so long, it's hard to see outside the box. Like fish don't see water, but as a young person, still early in my training, I was maybe in my late 20s. I was like, there's something more compelling to this than just what intervention is required. It was back to the test question. Here's the situation. What medication do you do? Or what intervention do you apply? I didn't ever really resonate with that. And I found that as I was spending more and more time in the hospital, as you get more advanced in your training, you're spending way more hours than you ever thought you would be in a hospital setting. I was seeing people go to C-section far more than I would have guessed. I was doing a lot of surgery and I didn't like surgery. I would have been a surgeon if I wanted to be a surgeon, if I wanted to do surgery, but the OBGYNs love doing surgery and they're really good at surgery. But when you do so much surgery, you start to see everything as a surgical problem to solve. And I was never there. I just never got there. I never liked being in the operating room. I was fairly decent with my hands and how I perform surgery, but that's because you just get a lot of practice doing it and you pay attention and you realize that, well, if I can be really good at this, then it's at least going to be an easier surgery for the person I'm here to serve. So let's not push that aside entirely, but then let's also think about, why am I waking up at 3 a.m. to put my hand inside a stranger's vagina to see what their cervix is doing? Like, who cares? Like, is this really matter? Does this really matter? Is this making a difference? And the answer is no. In retrospect, the more that I saw myself intervening, the more problems I noticed, developing. So, you found this problem. Doctor, what's the answer? Start Pitocin, synthetic oxytocin. Break the waters, start antibiotics, do all these things. And it was like, I just felt like I was intervening every step of the way. And I come from a background of like really, really honing in my own health. Ironman distance triathlon. I was, I did athletics my whole life, but, I was really committed to working with my own health. But in residency, not only was I not seeing that applicable in my clinical or hospital-based practice as an OBGYN, I was also seeing that it was like, I didn't have time and I wasn't being incentivized to take care of myself. So my own health fell apart while I was in residency. And we're talking like 4 hours of sleep per night. You're eating all this vegetable oil laden hospital foods. There's a Coca-Cola stand in the cafeteria. I was like, this is not a place where healthy people should go. And like, you pregnant people like are coming in here and leaving worse than you came in. So I started actually carrying around this big binder. I still have it here. Now it has like mortgage document statements and all that stuff in it. But it used to be chock full of papers that justified my unwillingness to intervene. And as I started intervening less and not doing as many routine cervical checks and not starting medications maybe unnecessarily, not opening waters prematurely, not even monitoring in the ways that I was trained to do, I was getting scolded. So I carried around a binder of papers that justified, and by the way, they're mostly papers from outside of the United States, that justified not intervening. And my patients were doing great. They were happy. They were having more vaginal births. My C-section rate plummeted. So I was getting less practice with C-section, which is great for everybody. I learned some other techniques that would help get a baby kind of restituted in the pelvis in the right way so that the baby could come out, vaginally, even if they'd had a prior C-section. So I really started digging into like the whys to, the reasoning behind contemporary maternity care in the United States. And finished residency, somehow flew under the radar sufficiently to get through there. I got chastised quite a bit. I was on remediation 3 times because even though I had the answers to the tests, they didn't think I really fit into that high acuity. They didn't see me acting like everything was an emergency. I even had one attending tell me that he's too calm in the OR. That was their criticism. I was like, I mean, this is just not for me. Like, it was a very weird process, but I tried to hold on to my identity sufficiently that when I finished, I maintained a very low C-section rate. I found a great job at Scripps Encinitas down in California. And there was a couple doctors in California that wanted me to join their practice, many who became very dear mentors of mine. And I was really interested in doing a fellowship in end-of-life care because I told you my dad was sick in medical school. I saw him go through that dying process, and I heard the counseling that doctors were providing, and it was so beautiful. It was like so different from what I had experienced otherwise. The hospice and palliative care teams that he saw were getting him to open up about his story and telling him, telling them about his fears and what his religious precepts were and his emotional boundaries. Like, who is this guy? Like, I didn't even know my own dad. And I heard this team unpack this man in such a beautiful way. And I was like, what if we could do that in our work in women's health? This is a very delicate, vulnerable space. Why not apply that? So I went into hospice and palliative care to become a better birth doctor, believe it or not. And of course, whenever you're close to mortality all the time, seeing so many people die, it really helps you appreciate the sort of miraculous way that babies come earthside as well. And you see it as less of a medical procedure and more of just this beautiful thing unfolding, whether you're birthing or dying. And so I maintained my identity sufficiently that while I was in fellowship, I was covering a practice. Actually, I just finished fellowship and I was covering a practice in Encinitas, and I got a call. This is a very low-risk practice, a guy named Nick Kapitanakis, amazing doctor, amazing friend, amazing OBGYN. He really is a good guy. But I got a phone call from somebody who had him in their previous birth. Her name was Angie, and I was like, I'm on call for him, but she's not technically in his practice anymore. Like, am I going to be protected from an insurance standpoint, or like, how does this whole thing work? I just didn't know. So the story was that she had a history of a C-section and she wanted to have a home birth with a midwife. So I got a call from her and she said, hey, my name's Angie. You're the guy I'm told that is the next best thing, right? Versus the guy that is not here, who used to be my doctor. My midwife is concerned because I have really high blood pressures and I eat really healthy and I take care of myself. And I was like, okay, well, I'll meet you at the hospital, right? So I went to the hospital. It's like a 30-minute drive from where I was living in Claremont, San Diego, and met this woman, and she had a birthing ball, and her midwife was there, and her blood pressures were really, really high. But as I was talking to her, I watched her blood pressure come down. I was like, there's like some fear here. There's some anxiety. There's a story. So I asked her about her whole story, and I heard about her first birth, and it was a C-section because the baby was breech. And then I asked the midwife, well, what do you think we should do? And she was like, I think that it's time to get labor going. And I said, I think I agree. So we started with some very natural herbal things. It's red raspberry leaf tea is a great way to get labor going, kind of encouraging it. It's not an induction method, but you just kind of encourage the body along. And, while I'm chatting with them, a gentleman walks in behind me and he's got all this accoutrement, like bags of stuff and different foods, home cooked meals. And I was like, what the hell's going on here? Like, this is not typical for people. They don't go to the hospital with their own water and their own food. And, he was wearing toe shoes, like those Vibram 5 fingers, and hemp pants. And he was also built like a rhino. And he's got to be in his 60s or his 50s. I was like, he's not that old, but he's also not like me. He's not like 32 or something, whatever I was then. And so anyways, I got to know them a little bit, and the labor kind of went forward. And after 3 days of us trying everything, her baby just was kind of stuck in the pelvis in a weird way called asynclitism, where I actually think maybe we got her labor going a little bit too strong. And the baby kind of just found a kind of an awkward position in the pelvis, but we tried everything. We tried spinning babies techniques and on the ball, in the shower, like for 2 days. And finally I said, Angie, I think we need to, why don't we get you some rest? Like, you're having a hard time. She was like, I agree. Like, let's do an epidural. Like, this was not on her plan, but she trusted me because we'd been sitting and chatting every day for hours, like really, really getting to know them. And this guy, her husband kept coming in and out and, hey, doc, try this water versus this water from my house. And I was like, that's a very unusual water you got there. Tell me about that. And he told me all these water charging stations that he has. And I was like, who are these people? Like, this is so wild. Like, clearly they've got all their health and everything dialed in. They've got a great relationship. He was there the whole time rubbing her back. And unfortunately, despite the epidural and all of my techniques that I just boasted about learning, I could not seem to get this baby to figure out a position to get through the pelvis. So ultimately, she decided on a C-section, and I brought them into the operating room, did a very quiet, low lights, did all this stuff, and then really took my time with the surgery, played music, got the baby right on her chest, did all that, and closed up the incision. One thing I always prided myself was I can close skin so you can't even see the incision. And that's what mattered most to my clients is I don't want to have a big, ugly scar. So after this, postpartum, this guy that I've been talking about, he brings me a book called How to Eat, Move, and Be Healthy. And I was like, oh, it's written by a guy named Paul Chek. His name is Paul Chek, so it's his book. Like, okay. And he wrote on the cover, "We're a team now," and, love Paul, or love and cheat Paul. And I didn't really think much about it, but, postpartum, they had to fight the vet pediatricians about vaccines. And I was like, why are we pushing vaccines? It's like a newborn baby. Just let them be. And I got chewed out for that. I was always the low man on the totem pole, but I stood my ground, and they were super happy with their care and went home. And Paul called me up, and said, hey, why don't you come and spend some time with me at my office? And I still didn't really know who Paul Chek was. Of course, people listening here know who Paul Chek was, but I really wasn't sure. And so I'd thrown his book on my coffee table, and I was like, yeah, I'll go and visit you. And I started flipping through, and I was like, God, these people are like me, but they're coming at it from like a health and lifestyle coaching standpoint. I was like, this is a great book for me to have in my office to give to people and all that. And so I went up to his office, and we did all the Paul Chek things. He introduced me to tobacco and stacking rocks and mandalas. And then he took me on a medicine journey, and he held my hand and sang to me these songs about the 4 doctors. And I was like, this is the weirdest day of my life. And I feel so at home. I feel so at home with this guy. And so fast forward, Paul and Angie Chek are really, really dear friends of mine. They were, Paul, during that day of visiting him, he encouraged me to really do something different. And I didn't take it seriously until COVID. And then at some point, there was like a launch button hit by the universe, and I was ejected from my job because of COVID-related stuff. And I found myself kind of in a space where I could start my own practice. And now I do fully holistic, spiritual, mental, emotional, physical, functional women's health, where I do whole sorts of things that I never learned what to do in school. I never learned how to do that stuff. And I still have the allopathic tools, but now I do as much health coaching as I do anything, and really helping people kind of dial in their connection to self, connection to their partner, connection to something greater. And my outcomes are better than ever. So I still do home birth now, but I do it on my terms. I do all of my work on my terms. I don't do routine pap smears. I'm really doing what I learned to do within the Chek Institute, but I'm able to apply it through the lens of allopathic medicine, because there are sometimes still times that we need that. It's just not 99% of the time. It's way, way less. Maybe 5% of the time do I have to lean on those tools. So that's kind of the brief, long story of how I got here. But yeah, I'll just leave it at that.
Cool. No, that's absolutely fantastic. Great story as well. So
yeah,
obviously I want to come on to talk about pregnancy, but before we do that, can you perhaps give an overview on your thoughts on fertility and perhaps why it's such a big issue today, and the sorts of things that couples can do to maximize their chances of getting pregnant?
Yeah, well, I think it goes back to the magic. The magic of childbirth starts with some pretty awesome stuff that happens in the body. And we're not just talking about hormones in the uterus and the fallopian tubes and ejaculating a bunch of semen. That's a part of it. That's cool. Like, we all know how that stuff, maybe we know how that stuff works. We're not really sure. I can't be certain about absolutely anything. But what really is compelling about this conversation is that you have this highly energetic ball of light, tens of thousands of them actually, that come out through the ejaculate, enter the vagina, go up through the cervix at the right time of your cycle, where the cervical mucus is ideal for creating channels for these little balls of light, these little fireballs, just to find their way up into the uterus. Any other time, they just stay in the vagina and they ultimately die. But at the right time, the fertile window, when the cervical mucus is just right, these balls of light, maybe a couple 100 million, are going to fly up through the cervix into the uterine cavity, into the fallopian tube, and they're going to meet this giant ovum in the darkness, this big evacuated egg, which is waiting for them. And one of the big myths here is that it's one egg, one sperm. It's not. It's tens of thousands of healthy, competent sperm that find an egg and surround it and form this beautiful preconception attraction complex. And you get this big halo of sperm all bumping into this egg 3-dimensionally on all sides. And at some point, I feel like they vote for one of their buddies to be the chosen one. And by the way, at this point, the egg is rotating. Under the microscope, it looks like it's rotating counterclockwise. I have no idea what that is, but this is the magic. At some point, then there's an explosion and this ball of fire is engulfed by this big ovum. And then there's this dance where the genetic material kind of starts to play into one another. And then, of course, 9.5 months later, if everything else works out, you have a baby. That is the story of fertility that I tell. But the story that most people think is that, oh, you got to make sure that your hormones are okay and check the blood and do the ultrasound and then have sex. And if after 6 months it doesn't work, then you end up in a fertility clinic and they're talking about a $13,000 bill to get IVF, which is when I take your sperm from your penis, I take your egg from your ovaries, and we put them in a petri dish together, just as I described, and we let them do that dance and then implant it into the uterus. That's IVF. That's a very expensive process, and it's very hard on a woman's body. And it's hard emotionally and mentally for the couple to go through this because you're not conceiving a child. You are sort of biohacking pregnancy or childbirth or conception, I should say. And that to me, it never resonates. Like biohacking's cool, but we can't biohack our way out of an unhealthy lifestyle. So the big question is what is going on upstream that has made it so that you now find yourself looking at a $15,000 bill to do something as simple as having a baby? And nowadays that's becoming ever more increasingly relevant as we're spending billions of dollars a year in the United States alone on fertility treatments, not just IVF, but everything in between. So the first point of consideration is a woman needs to understand fertility awareness tracking. If you can understand why your basal body temperature increases and why you're seeing the change of cervical mucus, you know exactly when to have intercourse because you want sperm in there before the egg is released. That's the first step. But if you're not seeing those changes to the cervical mucus and whatnot, then there's something for us to unpack. And furthermore, probably up to 70% of the time, the stats show it's 40 to 50%. I'm going to say it's upwards of 70% of the time. It's because there's not enough sperm that are healthy swimmers that have their DNA is intact. So what I mean by that is the DNA part is that under oxidative stress from all of these environmental and otherwise stressors, it could be EMF, it could be crap in our diet, it could be crap in our soil, in the air, in the water. There's all this stuff, plasticizing agents literally everywhere, especially in your dairy and all of this. It's everywhere, these toxins, right? When you introduce that and overwhelm the body, especially in our cells that are rapidly reproducing, such as your gametes, which in men are the spermatozoa, when you're going through this spermatogenesis process, you need the genetic material to remain intact because you might end up with a sperm that looks right, has a nice flappy flagella, looks like a ball of fire, but if it's the one that's chosen to be engulfed by the egg that I described, and the genetic material is fragmented due to this overwhelming stress from the environment, which in the cell, in the mitochondria, could be referred to as oxidative stress, then you end up with an egg, perhaps with perfect genetic material, meeting a sperm with fragmented genetic material. They come together and try to make a baby. And you might even get something that, like a firecracker that it's like a dud. And you end up with a miscarriage, right? And the women have been carrying this burden for years, but us men have just as much of a part here. So I work with people, again, on the truly holistic sort of scale from physical all the way up to spiritual for both man and woman, and trying to get them to see this in a different lights as opposed to just this reductive, your hormones on this day, here's what the ultrasound shows, the semen shows this. There is plenty more than we can do. But if you don't take a holistic approach, you may find yourself looking at that $15,000 bill. And I even made a natural fertility program at the Czech Institute to help people with this. It includes my first book, 150-page manual basically to this process. I could probably add 150 pages more because I learn more from my clients every single day because I listen to their stories. And with some basic, lifestyle modification, including like organ meats, oysters for both man and woman, you can see a significant increase in the quality of the eggs, quality of the genetic material, especially in the sperm. And you can do this naturally. I mean, almost everybody can do this naturally. There's very, very few people, maybe less than 1% to 2% who are truly infertile. But that's not the story that the mainstream sort of medical narrative tells.
Yeah, interesting. I mean, I've had a number of couples that have come to me and said, "Oh, we can't get pregnant. Can you help?" And the one thing that I've found every time is that both of them are overly stressed. And if you test the woman's hormones, that estrogen certainly is on the floor, and cortisol is either through the roof or that's on the floor as well. They're either acutely stressed or they're chronically stressed. Normally, chronically stressed. And you kind of think, well, no wonder you can't get pregnant if you don't have, optimal levels of hormones to start with. So it's interesting that you mentioned, you think a lot of the time it's the man, and it's actually, the toxic environment of the man, but it makes complete sense. Absolutely complete sense.
Yeah.
So really what you're saying is that, for, I think you said 70% of couples, I mean, there'd be no reason not for both of them to actually look at potentially trying to get whatever toxins they've got in their body out of the body.
Well, I think that, that principle applies to everybody. It doesn't matter if you're having fertility troubles. It's not a percentage of the population. Before you get pregnant, so here's the kicker. IVF, that process of artificially getting egg and sperm to meet and then implanting the embryo into the uterus, IVF is a risk factor for a variety of pregnancy complications. And it could be that the IVF process is just that challenging for the body. But more importantly, nobody ever really looked upstream to figure out why you're not conceiving. Is it a nutrient deficiency? Is it a gut issue leading to a nutrient deficiency? Any of the hormonal feedback loops can be disrupted. It could be a mental, emotional, or spiritual thing. Like, there's all these other things. So if you haven't dialed that stuff in and you force the body to get pregnant, you're just putting a Band-Aid on the issue, which is going to be unveiled. The Band-Aid's going to fall off in pregnancy, and that's why we see so much complication for IVF pregnancies. It's not just because you're old. There's plenty of healthy people who have totally normal childbirths, even if they're 45, because they've done all the work ahead of time. Yeah. So everybody should do that. The 70% statistic, I think, is more reflective of a man's responsibility. The burden is on the men here. And instead, we just say it's a women's health problem. No, if you have 25 million sperm in a single cc of ejaculate, 50 years ago, that may have been 100 million. So we've seen a 4 to 5 fold decrease in the number of healthy sperm that are in 1 cc, 1 ml of your seminal fluid or your semen, your ejaculate. And so nowadays they might just tell you, hey, you're fine, guy. Like, hey, your semen analysis is normal. And we forget about the guy. But actually, I think the guy actually has far more of a role here than we've really given credit in up to 70% of cases. So I don't think it's fair for us to continue putting the burden on women as if this is just a women's problem.
Yeah, absolutely. So I guess the other thing with that as well, it's not just about getting pregnant, but it's actually ultimately you want a healthy child as well, right? And in which case, doing those same things that you mentioned is going to help people achieve that.
Yeah, absolutely. Everybody talks about freedom, sovereignty. They're using all these really great terms, right? Well, if you're not as healthy as you possibly can be, your freedoms get taken away real quickly in our country. And that is, one side of that is if you want to fight the system, make it obsolete, get as healthy as you possibly can. The other side of that is that if you don't want to have a hospital birth, like, our friend Angie, she didn't want to have a hospital birth the second time around. So she was dialing in every aspect of her lifestyle through check principles in order to have the healthiest pregnancy possible. And she recovered well after birth. Granted, she didn't get the natural, the vaginal birth, but that's not the point. Sometimes that's not in our, we don't have the ability necessarily to change that. There could be some more cosmic reason as to why you had to have this baby come out by C-section. But she took it upon herself to have the option of having a home birth with a midwife because she knew that was important to her. So we can't just say the system sucks. Like, if you're not doing your part to take care of yourself, then everything the system does is sick care. Like, if you allow yourself to become sick, and I know it's not in everybody's, we don't all have the ability to avoid all illness. I get that. But if you aren't doing everything in your power, then we can't put all of the blame on the system either. And so if you want to have the most autonomous birth with all of the options afforded to you, then you have to do whatever's in your power to focus on the 6 foundational principles and the 4 doctors. It's just the way it goes.
And I imagine, I guess you probably don't get to see many of the children as they grow older, but, I'm pretty sure you'd expect to see, as they get to 5, 6, 7, 8, 9, 10, that, when parents have really looked after their health, that those kids are going to be much more healthy, much more functional. They're going to be happier, which is what everyone wants, right?
Yeah. Yeah. If that's the goal. Yeah. Don't mess with nature. Like, try to let nature do its thing unless you absolutely know that you need to intervene. That's how we change the world, because we're bringing generation after generation of kids that are getting sicker and sicker sooner and sooner. So we're doing something wrong. So anybody who's doubtful about my position on anything, like look at what we've got. Like, is this the best we can do? And if not, then let's be curious and let's think outside the box and try to figure out what other solutions might be there for us to explore.
Yeah, I mean, the other thing that's quite outstanding in that respect is the fact that the same country that uses the most childhood vaccines also has the highest level of infant deaths as well.
Infant deaths, asthma, autoimmune conditions. Like, this is a rich white person problem that we've inflicted upon ourselves. I don't know how old you are, Leigh, but when I was born in the mid 80s, and it was like 22 doses or something total of vaccines. Now it's 74 in the United States. So, and we're talking not individual strains or whatever that are protected against. It's the multiple doses of, for this bug, multiple doses for this bug. It was 22, I believe, in total. And nowadays, 74 doses are given to kids before the age of 18. Mm. That's a problem. I mean, it's depending on, regardless of whether you look at it from like the strictly infectious disease sort of allopathic model, or if you look at it through the lens of Rudolf Steiner, there's a whole bunch of problems with that, especially considering day one of life, we're giving hepatitis B to inflict pain on a kid who just arrived Earthside. You're going to inflict pain on this baby for what reason? Like, how is that baby going to get hepatitis B? I mean, it's just absurd.
Yeah. Yeah. Crazy. And that's a whole nother rabbit hole that we could potentially go down. But
yeah.
When 35-year-old Amanda first scheduled to see me, she'd been suffering for 19 years from severe IBS, diarrhea and fecal incontinence, along with abdominal pain and bloating. Her condition had not only made life uncomfortable for Amanda, but very inconvenient, as she had to walk 2 hours to work every day along a route that had public toilets, and she'd never been on holiday as an adult because of her condition. The only advice that several doctors and specialists had given Amanda was to take Imodium, and when she first saw me, she was taking 5 Imodium a day and wasn't getting any better. To help Amanda, I ran tests to find out what foods were right for her metabolic type, to see which foods she was sensitive to, and to assess her gut microbiome. Tests showed that Amanda had several food sensitivities and a parasite infection. Over the coming weeks, I coached Amanda to eat right of her type and to replace the foods she was sensitive to, and a protocol to deal with her parasite infection. And after 3 months, Amanda was IBS-free, and she also reported her skin was much improved and she had lost weight. And she booked a holiday for her and her husband to New York, as they'd never been on a proper honeymoon because of her IBS. And if you're suffering like Amanda was, and you want to get to the root cause of your problem, you can arrange a consultation with me at www.bodycheck.co.uk. And if we're a good fit, I could help you achieve the same kind of results as Amanda. Now, back to the podcast. So once a lady is pregnant, what would you say are some of the most common mistakes that you see with regards to having a healthy and uncomplicated pregnancy?
I think the primary number one mistake that I see is that people tend to overcomplicate it. You may have $1 billion at your disposal. You can't biohack your way through this. In fact, the best thing to do is to get out of the way and provide your body, your placenta, your baby with the resources to just do what the body and the placenta and the baby do. So that could be adding some additional, nutrients through some of nature's multivitamins. It could be through some directed supplementation, but for the vast majority of people, getting out of the way and supporting the body through salutogenesis to do the thing it does the best is really the way to go. I don't see any role really for most biohacking modalities in pregnancy. I mean, there's a couple, and it depends on how you define biohacking, but there are people that are like, we should have studies on the benefits of cold therapy and sauna and red light therapy. And do you think red light therapy is good for the baby? I'm like, I don't have any fucking idea. Like, I don't see any reason to be even asking that question. Like, my wife is not a Czechie. She does. We live a very healthy lifestyle, but she is not somebody who's out there exploring the frontiers of where medicine's going or whatever. And she didn't even want to read any books. She just ate healthy, moved well, breathed well, hydrated regularly, slept abundantly. I mean, as much as we could. And like had her mindset, her emotional boundaries in place. Like she had her stress management under control, and she had an hour and a half of labor and had 0 stitches in either of our pregnancies. We had a home birth for our second, and the baby was like out asleep on her chest, and the midwives didn't have anything to do. It was just like, okay, see you later. I mean, that's possible for almost everybody. And when we start to overthink this and we get our head in the way of our heart and we try to get involved with nature and do no differently from the allopathic model when we're trying to prescribe natural remedies and biohacking strategies for a problem that doesn't exist, that's when we get into trouble. So we tend to overthink and overcomplicate this above all.
Are there any kind of standard things in the kind of medical approach that you would say are potentially harmful for pregnant women?
Do you mean like on the food or on the sort of other modality side?
Yeah, I mean the one that springs to mind is ultrasounds.
Oh, that's a good one. Let's talk about that. Yeah. Yeah, so a lot of the things that we do in routine prenatal care, including ultrasound, have not really been enthusiastically pursued as research topics, let's say. So in the United States, it is pretty much dogma. It's accepted truth, so to speak, that ultrasounds are not dangerous in pregnancy. The issue is that using the word ultrasound has a whole bunch of different meanings. You can change the frequency, you can change the wavelength, you can change, depending on how long you're sitting on, these vital structures of this developing embryo, there could potentially be harm. I mean, you don't want to microwave your baby. And meanwhile, we're using a high frequency, basically causing a piezoelectric crystal to scream, and the sound waves of those screams are bouncing off the baby and back to this probe and heating up the water in the meantime. It's probably very loud in there. It's probably very warm. The babies tend to like get kind of fidgety when you put it on their body for too long. So we know that there's something there. Every OBGYN in the world has seen that. But we haven't been willing to open up the doors to research in the United States because we're not willing to admit that maybe what we've been saying is wrong. Because yes, it's not ionizing radiation as you'd find with an X-ray or a CAT scan, a CT, but there is a high frequency beam of energy, of a wave, particle just bouncing off of your baby every 2 to 4 weeks when you're in to see your OBGYN. So fortunately in China, there was a group of studies that have been published, and a guy named Jim West, I think he's from the States, maybe from the UK, but he went out there and took it all and put it into a book called 50 Human Studies. And it really ascertains the true risk of ultrasound in pregnancy. It is relatively unbiased too, because some of the studies there say there's no problem. We didn't find any issue. Other studies he included say there's definitely a problem here. So the point is, like, around ultrasound is that it's a great tool. We're as good at using an ultrasound as a cardiologist is at using a stethoscope. Like, we are very, very well trained in that. But if we're going to use it, we need to have a really good reason as to why we're using it. We need to do the minimum effective dose, and we need to do the minimum duration and frequency that is absolutely required. Because if you're not going to change your management based on the result, then why are you doing the test? This goes for functional medicine people out there all the time. Stop ordering $1,000 worth of labs and then seeing what comes up. That doesn't make any sense. That's actually worse than the allopathic model. And you guys should be ashamed that that's how you were taught. Go and find an actual functional medicine practitioner who can teach you how to do a clinical history before you order the labs. Well, the same goes for ultrasound. You don't just do the ultrasound just because you're curious. Like, if you don't have a reason to blast a baby with high frequency ultrasound pulse, then why are you doing it? So if you can follow those principles, it's still okay to occasionally have an ultrasound. My wife at the midway point, had a formal anatomic survey, as they call it, where they look from head to toe, just wanted to check things out. And she wanted to know the sex of the baby. So great. We did that. But apart from that, there's almost no reason, unless you think there's an ectopic pregnancy, which is not a normal pregnancy. You don't have to be worried about disrupting it. You want to be, reassured that if that ectopic is growing in a tube and it bursts, thank goodness we found it and we removed it before that happened, because that can be catastrophic. But this is not what's happening with ultrasound. Every time a woman and their partner goes to the clinic, they're going to get an ultrasound. And most people don't know to not ask for that. You can just say, no, thank you. I don't want that. And there's nothing that's going to, I know it's cool to see the pictures, but go and look online at pictures. Go and see what the radiology encyclopedias show you. That's a cool little baby. I know it's special. maybe getting one picture at some point in pregnancy is really cool. But to do it every single time through the research that comes out of China does demonstrate that we may be leading to behavioral issues, to anxiety, depression, other nervous system issues, abnormal let's just call them structural anomalies, like the kidneys not developing well, the brain not developing well, other structures not developing well. It's documented. We know it. So now what are we going to do now that we know? Are we going to run and hide? Or are we going to continue to just preach in order to support our internal bias so that we don't have to admit that we're wrong? I am great at admitting that I'm wrong. I want people to prove me wrong because that helps me improve the care for my clients. But we don't see that happen very often.
Mm. Yeah, I guess the way that most people are, I guess, taught or treated is that there's that expectation, I must get the ultrasound because if I don't, we might miss something and that would be terrible. That's certainly how I see it. I mean, do you see that pretty much the same in the kind of general public?
Meaning, like, what if I don't get it? What if something bad happens if I don't get it? Yeah. Well, there are risks and benefits to everything. Yeah. The good news is that most babies are not being born with any problems at all. I mean, granted, who knows? Maybe the autism and depression and all that is a result of what we're doing in the uterus, but it's going to be very, very hard to flush that out. Going back to the person who for the person who's having any sort of internal disagreement as to what they should or shouldn't do, remember that nature has this figured out. It is infinitely wiser. Your pregnancy is not deficient in ultrasound. It's not deficient in pharmaceuticals. Your pregnancy is not deficient in anything. If there's a reason for us to add to that, it's incumbent on us to demonstrate that without a doubt, this is better than the way that nature intended it. That's what medical research could be. But there's all these other issues within the publication industry and whatnot in our major medical journals, including your journal, the British Medical Journal, our journal, the New England Journal. It's fraught with issues. But again, if you want me to intervene in this otherwise beautiful natural process, it's incumbent on you to demonstrate why. It's not incumbent on me to carry around a big binder of papers justifying why I don't want to intervene in a natural process. It shouldn't be my job, but that is what it has become, is for us, quote, quacks out here, I'm using air quotes on my end, to demonstrate that the medical research is wrong. Like, I don't have to do that. You have to demonstrate that it's right. And that's where we're kind of twisted. So anything that we talk about in pregnancy, if you're having apprehensions, remember that this ultrasound doesn't necessarily provide you with a boon to your pregnancy. And now we have data to suggest that it might be detrimental to your pregnancy. So you're going to be an adult soon taking care of a child, and nobody's going to help you with that. Like, you're the parent. You're going to have to start making decisions, executive decisions, taking in as much information and counseling and advice and whatever as you can, and then deciding for yourself, am I able to live with the consequences of my decision if I do the ultrasound and there's a problem? And am I able to live with the consequences of my decision if I opt out of the ultrasound and something is missed? I can't answer that for you. Yeah. But what I will say is most people do just fine without ultrasound. Everybody in my practice does. Nobody gets ultrasounds. So
yeah. I mean, I have seen some data suggesting that from the time that ultrasound came in, the rates of autism have gone up. Now,
there's a lot of associations like that. Yeah.
And it might not be ultrasound on its own might cause it. It might be, I mean, again, this is an area I've looked in quite a lot myself, but obviously what they inject into babies can potentially have an effect, even whether the parents before they conceived were sleeping on a bed that was covered in electromagnetic radiation. If they had a mobile phone mast within 100 yards of their bedroom, or if they left their Wi-Fi on at night, those kind of things, plus ultrasound, plus, what they inject babies with, obviously all the heavy metals, the aluminium, the mercury, etc.
Totally.
When you add all those up, perhaps that might lead to something like autism.
Well, yeah, I mean, since we're on the topic, I think this is probably the most common question I'm fielding in general is around the vaccines. And I don't think anything has really changed in the vaccine world, even though I used to be an advocate for vaccines. I just didn't know any better. I mean, I figured there's not a good reason for us to be doing so many of them, but I was like, come on, we got vaccines, like aluminum, like big deal. I'm drinking out of an aluminum can right now, and it's not mercury. You're not going to get the Mad Hatter syndrome. Like, it's just, forget about it. You find aluminum all over the place in nature, in your spinach, whatever. But then COVID happened, and it really kind of compelled us all to really consider what's really happening here. And I went very, very deep into it. In fact, I've got a course coming out called Clear and Free. It's all around persistent HPV and vaccines and Gardasil, which Gardasil is a great example here, actually, because what has actually started happening within the vaccine manufacturing process that I wasn't really aware of is that when you test a drug, like here's, Mimi and Chase of the Medicine Podcast, they're Immune Intel HCC. This is made from the mycelia of shiitake mushrooms, and it has been compared against placebo and has demonstrated through those placebo-controlled trials to help clear persistent HPV, clinically demonstrated in people. HPV being human papillomavirus, which can ultimately lead to cervical cancer if your immune system is out of whack. So when you look at Gardasil, which is a vaccine now in the United States, it's almost compulsory for kids at age 9. It's not technically compulsory, but you really get a lot of grief from your doctor or from your school or whatever if Gardasil is not administered. Starting at age 9, it's a 2-dose course. Used to be a 3-dose course. And now that I have 2 little girls, I had to go deep into this, which is why I produced a course, which is kind of like writing a book where you're just go deeper and deeper and deeper. And you're like, oh my God, I never even knew I had to read about aluminum and the biochemical properties of aluminum within glial cells and all of that. But the issue with most vaccines, including Gardasil, which was only introduced about 20 years ago, is that most of these vaccines are not placebo controlled in safety trials. So even if you do have a study that says it's a go, like we had no issues, well, you're comparing it against what? Like, it wasn't more issues compared to a placebo that has what in it exactly? Most of the time, those placebos are made of water, some polysorbate 80, and an aluminum adjuvant. So the aluminum adjuvant alone we're in like the age of aluminum. Everything has aluminum. Your baking soda has aluminum. Your plants have aluminum. All of the fertilizers, like your soil, your water, your air, maybe not your air. It's not easily aerosolized, but the point being, you're getting,
It's in the bioengineering. Yeah, there's a lot of aluminium.
Oh, for like the chemtrails and all that. Yeah. Well, that makes sense because you can see it. It doesn't actually it's like particleized up there. So all of this aluminum that's being dumped into our system, most of it, 99.7% of it that we consume orally comes out in our poop, thank God. But now we're injecting it. And they have done 0 studies to really demonstrate how much aluminum is okay. I don't think there's any reason to have aluminum in the body. And if you look at Chris Exley's work, he's one of your local Brit, he's kind of like the foremost expert on this worldwide. He's been dedicating his whole career to aluminum, and he was never even interested in vaccines. And he was like, I don't know how it took me 30 years to realize this is a big problem, but we don't have any data to support the injection of aluminum adjuvants into the body as a safe thing. And now kids by the age of 18 are getting 74 doses, all with a little bit of aluminum. You add all that aluminum up and you're getting way more than we ever have in the past. So the question around vaccines to me is a very compelling one from the standpoint of like, who's actually looking out for me? Like, who is it out there that's trying to keep me safe? And I think, Radical Health Rebel, I think Living 4D, I think Kyle Kingsbury's podcast, certainly my podcast, I think we're doing our best. But it would be certainly nice if the other million medical researchers out there would do this from like a place of like integrity and like really, really help to provide us the information. Otherwise, I'm going to have to keep writing books and creating courses because I don't have any other option. I've got 2 little girls. Like, I want to make sure that they're taken care of. We have these chemical spills all the time in the United States because we have poor regulations. And there was a big chemical spill up in western Pennsylvania, or eastern Ohio, which is sort of in the northeast near the Great Lakes, Toronto area.
We know about that.
You know about the spill. So we live right on the Ohio River in Kentucky. The Ohio River comes out of Pittsburgh, and all of those little waterways around East Palestine, they dumped into the waterways of Pittsburgh and ended up in the Ohio. So we had to go and upgrade our entire house's water system or our greenfield system because I talked to my environmental, my EPA guys, and they're like, there's no way to protect yourself. You just have to do whatever you can for your family. Like the city, the councils, the whatever, they're not going to do this. They have shown time and time again, this is just going to keep happening. So you have to do it yourself. And that is a really, really tough place to be for a young parent.
Yeah, I mean, it's interesting, when you look at the so-called safety studies done on vaccines, on all the children's vaccines, they've always been, the placebo has actually always been a previous vaccine. So when you're you're comparing something that's toxic with something that's toxic, and they say, well, look, there's no difference in the safety signal. That's because they're all toxic, right? And the other thing, so I produced an ebook in May of 2020 called the Coronavirus Survival Guide. And I actually had a chapter on vaccines. And in there, I've got 2 studies comparing the health of children vaccinated versus unvaccinated. And the difference is huge. And I'm sure you won't be surprised to know that the unvaccinated have much, much less illnesses than those that are vaccinated. And since then, there's been a study by Dr. Paul Thomas, the pediatrician.
In his giant practice,
And he showed exactly the same thing, that, the children that had no vaccines at all were extremely healthy. And obviously the more vaccines they had, the more unhealthy they got.
That's right. Yeah. And he had a pretty interesting opportunity there. He's got a big giant practice with a ton of families that he's cared for from the time that they were born. And he had a group that was partially or fully vaccinated and a group that was partially or completely unvaccinated, right? I mean, he could parse that out in any which way. And his kids that were let's just say unvaccinated, just seemed to be way more robustly healthy, better behavior, better health, less asthma, less autoimmune stuff. They just seem to be better, equipped for the world. Don't you think?
Yeah, absolutely. So continuing on, because we could go on forever talking about that subject. Many years ago, I'm going back to the 1990s, I worked with quite a few women, both pre and postpartum. And, I used to really enjoy helping them through their journey. And they tended to have very good pregnancies, relatively easy births. They tended to not put on excess weight. So quite often, from behind, you would never know they were pregnant. Often you see women that are pregnant and they just put on huge amounts of weight. They just balloon up and they're all swollen, So what role or how important would you say exercise is before, during, and after pregnancy?
Well, of all of the lifestyle stuff that we talk about, exercise is the one that's the best documented, even in the clinical research. As much as I like to bash the medical publication industry, when we have studies that support these things, we need to really honor them, right? There's not any major industry out there that's financing studies inappropriately to demonstrate that lifestyle intervention works. So when those studies come out, I actually do trust them. It's not like there's any conflict of interest. Nobody out there is selling I don't know. It's not like Planet Fitness is supporting those studies, or whatever gym, CrossFit International or whatever. So I think of all of we have the 6 foundational principles. We have the 4 doctors. That is all really, really helpful in pregnancy. There's no doubt. But the role of exercise is especially relevant because we actually have clinically demonstrated benefits from exercise. So if you have any doubts about what's going to happen in your pregnancy, is my placenta going to be working well? Am I going to recover postpartum? Am I going to need a C-section? Am I going to be induced? Am I going to get gestational diabetes? All of those things are mitigated through exercise, regular exercise. Now, that doesn't mean that if you gain weight, that you're doing it wrong necessarily. I think that if you are gaining weight and you're diabetic, we've got a problem there. But some people do gain a lot of weight in pregnancy, like 50, 60 pounds. And they're some of the healthiest people I know. But that's not what we're seeing in the United States. The people who are gaining all that weight are not generally the health nuts. They're people that just haven't been given permission to take some responsibility. You've been conditioned in the United States from a young age that either the police and legal law enforcement, or politicians, or your mom and dad, or your teacher, or even your doctor are really kind of gonna drive the show, and you don't have to think for yourself. It's not on you. Just keep giving your power to us and we'll take care of everything, right? The benevolent dictator, and in pregnancy, of all of those things we can do, exercise is absolutely critical. And it doesn't even matter how you exercise. Like, you just have to keep yourself moving. You got to move blood, move lymph, keep your heart strong, keep your muscles toned, keep your insulin sensitivity up, keep your digestive system moving. Like, all of that is so relevant. And all you need to do is, like, a couple times per week, take a couple mile walk with your partner. It's a great time to talk about your birth plan, about what's coming, connecting months before you might never connect in that way again when you have a baby here. So my wife and I would go on walks in the woods. We went as much as like 9 miles in her third trimester on a hike in the Red River Gorge, or somewhere here in Kentucky. And she was very sore afterwards. She was like, that was too much. And I said, I agree. Like, we shouldn't have gone that far. But we didn't have to go 9 miles. We could have gone 3 miles and just spent time in nature, getting some sunshine, getting our muscles moving. You've got a bowling ball. You're basically have a weight vest on. So just go walking. That's exercise. But if you're also like a CrossFitter or a marathoner, there's no reason to not keep doing the things that you're doing. If you're a well-trained athlete, doing the sport of your choice is probably going to be the best thing you can do for your mental well-being, your emotional well-being. Like, this is important stuff. So, unfortunately, I think people have been scared into thinking that you're this delicate flower in pregnancy. You're the healthiest you're ever going to feel in pregnancy. For most people, you're going to be glowing. My wife said, I love pregnancy. I don't want to give birth again, but I loved pregnancy, especially our first one. And I mean, her hair looked good. Her boobs look good. Her skin looks good. Like, her like butt looks good. Like, she just loved being pregnant, and we were moving. We were eating well. I mean, it was just an awesome time in our life. Your doctor will tell you, you need to be careful with the exercise and weights and all that. Like, it's baloney. It's bullshit. You can do whatever you feel confident in doing, without eliciting pain. We're not talking about like the burn. We're talking about pain. So there's a couple groups out there, like BirthFit is one. I don't know if they're around the world, but BirthFit does pregnancy and postpartum specific lifestyle and strength and conditioning programming for pregnant women. If you're listening and you're in the States, go and check out BirthFit's work. Those professionals, the BirthFit professionals, I happen to have done their coaching course as well. And they bring everything from muscular strength and like body weight to, in order to like recover postpartum, to like polyvagal theory and managing your stress and your emotions in the birth itself, how to prepare for the challenges of the birth itself. They're excellent. And you're not going to find that in the general community. Even in our Czech community, there aren't a lot of people that have specific training in pregnancy and postpartum, which is why I sound like such a broken record, I think, to people. But this is a really, really compelling niche. If anybody out there wants to get really good at something, we need women to be encouraged to exercise, because the benefits abound, Leigh. I mean, there's no downsides, almost zero downsides to even lifting weights in pregnancy, especially if you're adjusted to that and you know what weight you can lift safely and you know the right biomechanics. But that's where, again, having a professional who's trained with that, even if it's a Czech practitioner, to go in and help dial in, where's your hip and your neck and your cervical spine? Like, what are you doing with your hips? How do we adjust our center of gravity? All of that stuff.
Yeah. Catherine had always been fit and active when she suffered a debilitating back injury. She was barely able to get out of bed or walk without being in excruciating pain. She visited her GP, who prescribed anti-inflammatories, painkillers, and muscle relaxants, and also referred her to an orthopedic consultant. Catherine was bedridden for 10 days and subsequently could only get through the day with large doses of the prescribed pills. Catherine was diagnosed with a prolapsed disc at L3-4, and she was offered anaesthetic injections or spinal surgery. She was horrified and concerned that she would have constant back problems for the rest of her life. Catherine was miserable, could hardly drive, a day at work was agony, and any movements in bed were very painful. I carried out detailed postural assessments, muscle strength tests, and analysis of her movement patterns. I identified the biomechanical problems and prescribed a very specific exercise program to correct her posture, reduce her level of pain, and to prevent the injury reoccurring. After 5 weeks on the program, the pain had reduced hugely in her back, and Catherine stopped taking painkillers. After 10 weeks, Catherine was back jogging and doing more intensive exercise with absolutely no back pain, and she was so pleased that she was able to pick up her young son again. If you're suffering like Catherine was, and you'd like to find out more about getting to the root cause of your back pain, go to www.bodycheck.co.uk and request a consultation. Now, back to the podcast. Yeah, it's interesting. I remember one lady I worked with, it was in 1998, and she already had 4 kids. And she'd been a client of mine, I think. I know 2 of those were twins, but I think she only had 1 child when she first started working with me. So this was now that she was having the 5th. So she'd worked out with me probably 3 times a week leading up to the birth of the 5th child. And she ended up having a cesarean. And 6 weeks after, she rang me and she said, "Oh, can I come in to see you?" And I said, "Well, it's a bit, I'm not too sure I can do that because I'm meant to wait until you've had your 12-week check because you've had a cesarean." And she's like, "No, I really need to exercise. I really need to exercise." And then I started thinking, well, how is she coping with, so the 4 children she had were under 6 years old. Now she's got a new baby. Her husband works for the government, so he was never there. So I was just imagining, what must it be like when she goes to the supermarket? She's trying to deal with 5 kids under the age of 6, making sure they don't run in the road, pushing along a trolley. And I thought, well, surely, as long as I keep it lower intensity than that, she's going to be all right.
Yeah, right.
And I thought, if it's going to be really controlled and, it's going to be kept really safe, I'm not going to do anything silly with her abdomen. It's got stitches. And I said, okay, because she begged me. And I said, look, okay, but, you've got to be really careful. Anything, if it hurts, you tell me, we stop. And I said, but I'm not going to do anything that's more intense than what you're already doing now. And when she came in, I said to her, I'm just curious, how'd you get the kids in and out of the car? And the way she showed me, I mean, she was like a gymnast just to get in and out. Like she literally had to open the car door with her foot as she's hanging out the children. So I said, well, we're not going to be doing anything as intense as that for starters,
That's right.
By the time it came to the 12 weeks, she went and had a 12-week checkup, and the doctor said, "What on earth have you been doing? I've never seen anyone heal this quickly before." And she said to me, "I feel amazing." She said, "I've never felt this good at 12 weeks after having a baby before." So that's just one example of, as long as you use exercise carefully, it can have massive benefits. But whilst this was exactly the same time, there used to be a lady that trained at the gym, and she used to train really hard. She trained like a professional athlete. I don't think she was, but she trained like a professional athlete.
Yeah.
And, you see, I never really spoke to her, but, you see the same people that come into the gym, and you see her bump getting bigger and bigger week by week. And then she gets to the point and you think, wow, this woman's going to burst, but she's still coming into the gym. She hadn't put on any weight anywhere else. She just had this belly. And I remember looking at her thinking, wow, she's got to be due any time now. And I remember this very vividly. She's doing lat pull downs and she was pulling a pretty heavy weight. And I'm thinking, wow, she's got to be close to, having the baby. So anyway, the next day we didn't see her in the gym. The next day she was back in the gym. She'd had the baby the day she didn't come in. The next day she was back in the gym. And it was just like, wow, that's just incredible to see that. But then again, when you think about it, how did we get here? How did we evolve? What would women have been doing 20,000 years ago? Right? They would have had to have done probably the equivalent of a workout the day after they had their child anyway.
I don't think that I don't think anything changed. I mean, we still see this in other parts of the world. Infant or let's say the risk of like stillbirth, is so absolutely low. It's not like we're seeing in India and in Malawi and in wherever, where there's a destitutely poor population, that those women just aren't having babies, or that they're having miscarriages left and right, or stillbirths, so the babies are dying. I mean, the neonatal mortality side is actually more relevant in the body. Like, that baby's cushioned by amniotic fluid and a big uterus, and that's suspended and inside the pelvis with all these ligaments. Like, it's sort of like your brain inside the cavity. Like, you have to hit somebody's head really hard to concuss them. The brain's just like kind of bouncing around in there. So I don't get a concussion from whipping my head back and forth any more than a baby inside the uterus is going to be concussed or damaged in some way by exercising. I think in most countries, I mean, I used to do a lot of work in East Africa, and women there would have like their babies and then just walk home. Like, it was like remarkable. I mean, we make such a big deal about this. And, I think it's relevant to point out that despite us spending logarithmically probably 1,000 times more money than, let's say, East Africa, Malawi, for example, on healthcare, we don't have 1,000 times better results. So it's not just a money issue. It's not just a data issue. It's like really our inability to see this whole process is something that, like, the body knows how to do. And actually, the more that we cast you up, your limbs and your arms, and tell you just to sit and rest, the worse your outcome will be. That's actually been vetted out with the data. So exercising is critical. It's critical.
Yeah. So pre and postpartum women often have aches and pains. We all see that. What would you say are some of the most common aches and pains that you see, and what do you put it down to, and how can they help to reduce the likelihood of pain?
I think it starts before pregnancy, is really getting your posture dialed in, your spinal positioning. How is your head related to your shoulders? How is your sacrum related to the pelvis? Or I should say, how is your pelvis related to the spine, let's say, and your sacrum? So a lot of us are very, very lordotic. We have this like kind of our butt stuck out in the back, and that puts this sort of hyperflexion in the lower spine. A lot of us on the top, like the upper half of our spine, hunch forward. I mean, I'm kind of doing it right now, so I'll posture up a little, but that then puts our, the upper part of our spine into this sort of kyphotic pattern. If you go into pregnancy like that, and now your center of gravity is shifting by a few millimeters every day, it's going to worsen whatever, bad habit you've developed with your spine. So I don't think that that's entirely the solution for everybody, but I bet most people who have a, back pain, like chronic back pain after pregnancy, they blame the epidural, they blame whatever, pulling your knees back to the ears. I think that that's all relevant, especially the way that we force women onto their backs and force them to strain even without being able to feel through biofeedback if they have an epidural, how they're pushing. I think that that's a recipe for disaster. But more importantly, what was your posture like? How did you move beforehand? Because if you didn't get back pain, in pregnancy, you would have ended up with back pain anyways, because you actually aren't taking care of your mobility. You're not actually moving well. So this is another reason to get started early. That's why I want people to start working with people like 60 to 100 days before they even get pregnant. Let's dial in your posture. Let's dial in your technique. How are you relating your limbs to your spine? How are you sitting all day? If you're hunched over all day long, you're going to start developing back pain. It's just in neck pain, and maybe some cervical spinal issues, where the cranial nerves aren't working as well anymore. You might get Bell's palsy. I mean, like, there's all kinds of weird stuff, trigeminal neuralgias and whatnot that develop. And everybody thinks it's like, oh, this unfortunate thing that happened to me, but nobody told you your posture matters. So in pregnancy, after, maybe you had a C-section, now you're bedridden for a little bit, and you're holding a baby breastfeeding. That's all opportunities for your posture to degrade and for you to develop a chronic back pain pattern. That's probably the biggest pain. I know a lot of people do get pain in their hips, in their pubic symphyseal. They get pubic symphyseal pain. Yeah. The hips, the vulva, you can get a lot of pelvic floor dysfunction afterwards, especially, again, if you don't have a balance of, let's say, tension on one side versus the other of the levator ani muscle, which includes 3 different muscle groups, which is called the pelvic floor. Your obturator internus is oftentimes underappreciated. Your piriformis. These are the muscles that can get very, very tight if you have a hitch in your step when you walk or run. That all is relevant when you're having a baby, because your pelvis opens up, it transforms, and then it closes, and then it wants to get back to a functional position. But if you've got a spasm on one side versus the other, then you're going to probably end up with pain. And that doesn't necessarily need to be pelvic floor pain with intercourse. It could be back pain referred from your pelvis. I mean, there's all sorts of interesting connections when you start studying the fascial planes and whatnot. And a good friend of mine, Chris Crawford, he's a Czech practitioner as well. He's a high-level LDOA practitioner and a soma therapist, and he's studying original osteopathy. And he has quite a bit to say about this. It's kind of what his specialty is, like a pelvology kind of approach to the musculoskeletal system. So, a good physiotherapist, I think is what they call it in most countries, a physical therapist in the States that can actually do some biofeedback work and having you contract, let's say, your glutes and then tightening your pelvic floor and then relaxing your glutes and then holding onto the pelvic floor, like those types of exercises, those biofeedback exercises. I've had somebody do that on me. In fact, Chris did it. And it's very, very hard, but developing that coordination is actually a part of living optimally. And it's underappreciated. We just think exercise is for building muscles and all of that. No, it's to make sure that your body is equally strong and fluid on the left versus the right side. And so, if anything, I think pregnancy unveils underlying biomechanical issues as opposed to necessarily creating them de novo. I'm curious, what do you think about that?
Well, in terms of generally, what I've tended to see is lower back pain.
Yeah.
Pain coming from the sacroiliac joints. And obviously, as you were saying, the pelvis is opening up.
Side joints. That's right.
And I completely agree that people should start before they even think about getting pregnant. And I would actually say a lot longer than what you suggested. Not just from optimizing posture, but also diet and lifestyle, because what I would certainly suggest that most women need to do before they get pregnant is to get a really good functional abdominal wall. Now, what a lot of people fail to recognize is that if you're eating a poor diet and you're causing inflammation in your gastrointestinal tract, then your chances of actually having a functional abdominal wall is very close to zero. So it's not just about movement or exercise, but it's very much about what you're putting in your mouth as well. So really learning how to eat properly, make sure you're hydrated, optimizing posture. Again, I completely agree with what you were saying. Obviously, what does happen during pregnancy is that, and then you were talking about the center of gravity shifting. So women do naturally go into what we call an upper cross syndrome. So they get that rounded shoulder posture, and they get more lordosis in the lower back, trying to balance out the weight of the baby in front. That's just a natural changing of the posture. Now, that in itself can cause issues. And again, that's probably a whole nother episode to go into. But, the key one I would say there is obviously you've got facet joints at the posterior side of the lumbar spine. They're getting closer together. So it's possible that they can start to irritate each other and cause issues. But again, if you've got a fully functional abdominal wall, it's less likely to be an issue. The other thing sometimes that can be useful as well is using, and again, I don't know what your view is on it as well, but it's to use a pelvic belt during pregnancy if people are struggling with pain. Do you have any views on that?
Yeah, an abdominal binder. It's specifically relevant if you get pain. Anybody out there who's listening, if you lay down on your back and just have somebody take your pregnant belly and push the uterus to one side or the other, you get a lot of this, what's called round ligament pain. The round ligaments are these, they're very, very thin ligaments that normally hold a very tiny little uterus just suspended there in the pelvis. And the intestines and everything go on top of it. No big deal. It's just all padded there. But as the uterus gets bigger, these little round ligaments get pulled. They're like these suspenders that are overstretched, and it can be very, very cause like a very sharp pain, especially when you stand up and lean over to pick up your shoes or whatever. You can get this round ligament pain. So the problem there is that the uterus is just sitting so far away from the center of gravity. As your center of gravity shifts, let's just say, that can become an issue. So I actually find it's very helpful, even for really for a lot of different types of pain. Even back pain is bringing the uterus closer to center of gravity. And that can minimize the pain from your round ligaments or that lower back pain in the future. So an abdominal binder is what we call it here, but it's basically just bringing the uterus closer to your spine, and that can do wonders in the long run.
Yeah. One of the big challenges that I see as well is sleep deprivation, both pre and postpartum. What advice would you give to women who are having trouble sleeping pre and postpartum?
Yeah, first off, go get yourself a large U-shaped memory foam pillow. And if you're a guy listening, go and get that for your pregnant partner, because that is a game changer. We've given so many of those away. They can be a little pricey, but it is well worth it. It's like the best $100 that you might spend. And the reason I suggest the U-shaped one is you can position it in so many different ways for you to put your legs around it, wrap your arms around it. It really can help you keep the body in a more neutral position so that your head is comfortable on the pillow. That can be very, very helpful for sleep, but sleep hygiene, of course, is going to be relevant. And the most important thing is that there's almost no way to get adequate sleep after you have a newborn. It's a part of the deal. But if you're going into pregnancy and you're going into the birth itself because you haven't been prioritizing sleep for the 9.5 months, you done fucked up. You have to prioritize sleep before the baby arrives, so you have the adequate reserve, so you're not throwing yourself into a spiral of HPA axis dysfunction after the birth of the baby. You are going to end up there anyways. Like, you will end up extremely tired and exhausted and irritated and agitated and all of that. But it's going to even be worse, and it's going to be very hard to recover anytime soon if you go in with a low reserve. So the best treatment, of course, is prevention here. I say get as much sleep as you possibly can. Try to minimize alcohol, minimize all of the stuff that you know disrupts deep, restful sleep. Try to stay away from the benzos and the Benadryls and all these other, sleep aids, which are just sedatives. You can start using some magnesium supplementation. There's certain products from like Bioptimizers that has a little GABA support in it. Great products. Don't go heavy. Don't go crazy with Sleep Breakthrough from Bioptimizers. That stuff will knock you out. But it's not a sedation. It just ends up being like way too much GABA if you take all 4 scoops that they recommend. So 1 to 2 scoops of that, some magnesium supplementation, and of course, the other thing that your adrenals and your hypothalamus and pituitary need are adequate nutrition. All of those micronutrients and cofactors are actually going to help mitigate the sort of inevitable sleep disruption that you're getting later. But if you haven't started, turning off your Wi-Fi router at night, the blue light blockers, of course, minimizing screen time, all the basic sleep hygiene stuff is still the mainstay. We can't biohack our way out of the reality of a newborn wanting to wake up every 2 hours to feed. And the other thing I will add, though, is that I didn't really buy into this until we had our second, but we actually did occasionally take turns sleeping in different rooms so that at least one of us would be really well rested. Now, my wife wasn't the one that could do that, but we would sleep in different rooms every once in a while so that I could be fully capable of taking care of myself during the day, so that my wife, as joyful as it was to breastfeed, was going to be increasingly tired. And she just had somebody with a full battery, in the kitchen to cook and to clean and to help. And then the last thing is ask for help. If somebody in your life says, "Hey, what can I do?" Give them a job right then and there. Make me a lasagna for tomorrow, or whatever, whatever you eat.
Yeah, and the other thing is power naps as well, where possible.
Yeah, I mean that's hard because it is hard. You're right. Power naps are helpful, but the thing is that when you have a baby, oftentimes women and their partners are going to have a hard time getting any sort of restful power nap when the baby is right in the other room. The baby's naps can be very short. And yes, it's like, great time to do a nap. But that's also the limited time that you might actually get to do laundry or eat something healthy or whatever. So when people are like, sleep when the baby sleeps, yes, but in practical application, that is actually far more challenging than people really think. I thought it'd be a lot easier, but it's actually quite hard to get a restful nap during the day. But if you get a 4-hour gap, yeah, absolutely. If you've got nothing else to do, there's nothing better than sleep. Absolutely.
Yeah. The other thing I would just add to that as well is it's probably worth checking where your bed is with an electromagnetic meter, just to see what the levels of electromagnetic radiation is where you sleep.
Yeah.
It might be you need to move your bed, or it might be you need to get someone in to kind of help you with that. But obviously, turning off your Wi-Fi at night is definitely something you really should do.
Yeah, absolutely. I mean, the whole electromagnetic thing is really tricky right now because it's almost impossible to not have some influence of electromagnetic radiation in your life. So turning off your routers, kind of like the bare minimum. There are some people now that are like shutting off the whole power input to the house with like a master switch. I guess if you can do it, but I mean, it's not like we all can go out and live in like a hermit at the top of the mountain. There's 5G towers everywhere now. It's a good start, but I'm not so sure that it's, unfortunately, I don't know. I'm feeling a little more pessimistic now. I'm not so sure that it's possible to really live without the influences of EMF. But hopefully, I mean, maybe that'll change. I don't know. I think more people were opening up their eyes to it during COVID, but who knows?
Yeah. And I mean, the other solution, well, one solution is obviously the biogeometry equipment is very useful for mitigating that as well.
Yeah, I use we have a couple cubes in our house. We've got all the windows with L90s. I've done their beginner and advanced training. I think that of all of the things, I think that and like getting a core harmonizer, like Paul, our buddy Paul Check has one, or a couple of those. I've got one here where I use it to grow my mushrooms. It really does harmonize the room. There's a very different feel in the room when it's on. And, there's Vogel cut crystals, Ross Newkirk's technology at Conscious Technologies LLC. There's a lot of good companies out there making these types of devices. But when you go to buy one of those devices, you are going to get what you pay for. I will tell you that. Like the people that are really doing this work well and not just mass producing junk, you're going to pay them a little bit of money for it. Yeah. So I always tell people, don't go for the cheapest option. Don't go for the most expensive. Get the middle to high option, and you're going to be fine.
Yeah. So I've got one more big question for you. And we've touched on it a little bit, but it'd be good to go into a little bit more detail. So with regards to the birthing process, what are your views on the general medical approach, and how do you work differently, and what are perhaps the benefits of your approach?
Do you mean to birth itself? Is that what you mean? Yeah. Well, a lot of people have been reaching out because of the circles that I run in, and I haven't been able to see everybody. So I put together a program that really does kind of clarify my approach. So I'll kind of walk you through that. The first, I think, is, and it's called the Born Free Method. If anybody's interested in enrolling, we take people internationally. It's basically a 12-month coaching program where you meet with us every single week, me and an experienced midwife named Sarah Rosser. You meet with us every week for 12 months, and we answer questions, we give lectures, we bring in guest speakers, we do the whole thing so you can have a full appreciation as to what this approach might look like. But then in addition, you get about 100 video modules that are each educational lessons on radical responsibility in birth planning, where to have a baby, who's going to attend your birth, all of that stuff. But then there's also quite a bit of time dedicated to lifestyle modification in order to avoid all of the complications under the sun. We go over the risks, benefits, alternatives to everything from vaccines to ultrasound to other injectables like vitamin K, Rogam, antibiotics, C-section. I mean, we go through everything that we could ever be asked. And so when you approach pregnancy through the lens of not being at war with nature, but in alignment with nature, things just go better. So most of the lifestyle modifications are not going to be like, here's a protocol for using red light therapy to have a healthy pregnancy. No, it's going to be like, you need to sleep, you need to eat well. You need to drink lots of clean, structured water. And I do a whole lesson on water itself because it's so critical. Here's some basic movement patterns. Like it's all of that stuff. And a lot of it doesn't cost us anything. It just is trying to prioritize our time and resources towards making these changes so that you don't avoid these otherwise preventable pregnancy complications, and so that you don't end up with a birth that is not anywhere close to what you were hoping for. So everybody loves freedom and all this stuff. But if you're going to be truly free, you have to be willing to own the outcomes of your decisions. And that's for the better or for worse. So we support sovereign birth. We support free birth. We support hospital birth, elective C-section, whatever it is that you feel is the right mode for you. I'm not going to tell you one way or the other. I think that most people would be just fine having a birth vaginally at home, regardless of what their clinical situation. Most people, with a midwife, of course. But that's not for everybody. So we try to accommodate everybody there, regardless of the history, regardless of whatever. You're going to go into your birth feeling as empowered as empowered and sort of intuitively guided with nature as your guide as possible as you approach your birth. And there's also a unit for dads, which I think is sorely underappreciated right now, as to how men want to show up in the space and be responsible, conscious parents and partners and fathers. And then there's a whole unit on psychedelics and cannabis and other drug use in pregnancy. So a lot of the topics we cover are not very mainstream. Like there's not a lot of people talking about these things, but I'm getting so many questions that I figured I need to put it together in a course, and I need to provide coaching for people as in a group setting, because I can't see every single person one-on-one. So that's basically my approach. My C-section rate has remained low. My complication rate is nearly zero. I mean, there's always going to be those things that we can't predict and avoid, but I'm fortunate enough to have also experimented with enough clients, so to speak, where I see that, wow, when you're eating organ meats, when you're eating oysters, when you're eating bone broth and eggs and cod liver oil, and you're moving regularly, and you're drinking clean water, you've got your emotional boundaries in place, your stress is managed, you're sleeping well, when you're doing all of that, that I don't actually have a job anymore. There's no reason to have me there. And there's still a couple people that will need that, but not at the rates that we're seeing in the United States. So through our work, I think we're on the right path to changing maternity care through the basics of our check principles, to be frank.
Yeah. I mean, I don't know what the protocols are nowadays, but I certainly know here in the UK, going back a few years, if a woman was having a baby, she's lying on the treatment table, her feet are in stirrups.
Yeah.
And off you go. Again, I don't know if that's changed over here in the UK, but what's your view on that?
Kind of reminds me of that Monty Python sketch. Remember that one where they're all like leaning over her and they're yelling at her to do certain things, and there's all these tools and equipment, and then a baby comes out like it was like from the view of the woman giving birth. It's classic. Yeah. So a lot of women are still forced onto their backs. Oftentimes, it's such an exciting time that you don't even know to say no. Like if you want to be like advocating for yourself in the throes of this spiritual transformation that is childbirth is not what we should be advocating for. If you're in the hospital, there's a way things are done in the hospital. If you don't want that, it's best to find a midwife to have a home birth. The reality is that when you're pushing on your sacrum and you're pulling your knees back and people are yelling at you, it's just not the right environment for birth. I mean, and I'm willing to say that there's a right and wrong way. That's not the right way. And it's not like I prefer to be yelled at and to have, be numb from the nipples down and to have my knees pulled up to my ears. I prefer that. Like, okay, like you're 1 in a billion, like you do you. So I'm not going to say that it's wrong to feel that way. What I am saying is that when we compel people to do it this way, as if there's no alternative, that we sound like total dickheads. Like we're not helping anybody. We're just fluffing our own sort of egos or whatever. We are not the captain of the ship. You are ultimately the captain of the ship. And if you want to birth on your side, on all fours, in a tub, in the shower, on a house with a mouse, whatever, like, you should be able to do whatever you want. And most people who have home births, who don't have an epidural and whatnot, they end up in all fours, almost like in a prayer position, because they're trying to get rid of all of that extrasensory stuff. And I don't mean extrasensory in the way of like Gary Zukov. I mean like, let's eliminate visual disturbance. Don't talk to me. I don't want to hear or taste or smell anything. I just am inward doing this hard work. It's like truly like a psychedelic journey. And I'm only able to speak to this, vicariously through my wife and all of my clients. But when you leave a woman alone, they tend to get into a position that feels comfortable. That's the right position. It doesn't mean being on your back is wrong. My wife gave birth on her back in exactly the position that everybody says is wrong, but it just felt right to her on our bed, in our bedroom, on our bed, and Everly came out just fine. Other people might say, I don't want to be on my back. And then a nurse and doctor forcing you to stay on your back. That's the problem. So there's all sorts of ways to give birth. In the hospital, you can expect it to be very disruptive. Lots of lights, sharp things, lots of people yelling at you and pushing you to do things. Maybe it doesn't feel right. You don't even have time to make sense of it. You just go along with the program because it's just such a whirlwind, I'm sure, of an experience. Whereas at home, we're on your terms. You just get to do it the way you want to do it. I don't walk in and track muddy shoes in there and say, I'm the boss now. I say, hey, how can I be supportive? That's what midwifery care looks like. And so that's what I try to do in my practice, although I'd never call myself a midwife. I do not deserve that title. Midwives are special people.
Yeah, I mean, just thinking of, most other mammals obviously give birth on all fours. I don't know about apes. What about, have you ever looked into how other apes give birth? I'm pretty sure.
I think apes give birth hanging from one arm. and then they catch their baby with the other arm. No, I honestly don't know. I don't think I've ever seen an ape give birth. A lot of the four-legged mammals, the quadrupeds, are doing it on all four. So I wonder if apes, given that they generally are kind of bipedal, I wonder if they're actually kind of in an upright position, which is interesting because a lot of women, even us humans, instead of being on all fours, some of them just want to squat and then they catch their baby between their legs, which kind of looks, I'm imagining a chimp or an ape looking a little bit more like that than a lioness. I don't know. We should look it up. We should get back to that. We'll do that in round 2.
Interesting. Fantastic. What's next for you, Nathan?
Well, we've got this. I just launched that course. We've now got a course. You're going to love this. It's called Clear and Free. It's a sort of the ultimate guide to supporting the immune system to get rid of persistent HPV so you don't end up with cervical cancer. So this is my deep dive into vaccines and aluminum and all this other stuff. We'll be enrolling for that in October, November. So people can look out. I mean, I went as deep as I could possibly go, focusing on Gardasil as a vaccine, which was not compared necessarily against other vaccines. It was compared against placebos that just had aluminum adjuvants, which is just completely ridiculous. So we went deep into that, but also into the sort of pathophysiology of HPV, the immune system, how the immune system can optimally function. And then we use the 6 principles and 4 doctors to help people to reclaim their health and their vitality, really. This HPV things, guys, is not that big of a deal. It can lead to cervical cancer, which is a big deal, but it takes months for HPV infection to lead to dysplasia of the cervix. Then it takes years to decades for that to turn into cancer. So while you're waiting for the repeat biopsies or repeat screens or whatever, there's plenty you can be doing in the meantime. And that's what our doctors and other practitioners maybe just aren't privy to. I don't know why, but in that 6 months that you're waiting, why not dial in your health? And this HPV thing will just be nicked. It'll be nipped like that. Viruses are pathogens. They're not enemies. They're there to provide some sort of environmental message. And if you can't integrate that message, that's when you start to worry about cancer. But we shouldn't just be chopping off people's cervices and misleading them in ways that would suggest that there's nothing in their control. There's always something we can do to improve our health. Even for me and you, we've got this stuff dialed in. I'm always challenging myself in ways to get a little bit better and to take out the fat, to cut out the unnecessary supplements, trying to do what's really best for my body, my family, my kids. The story around HPV is that's a signal that you need to do something better to care for yourself. So that's what our course is about. That's what's coming up. I'm also writing a couple books. I think the first one's going to be called Lies My OBGYN Told Me. We have to see if there's a market for that one. But I've got plenty going on, Leigh. I do appreciate you taking some time to have me on your show.
Oh, it's my pleasure. And where can people find you online and also find information on your courses?
Yeah, if people want to find the courses, bornfreemethod.com is where they can go for that. My practice is Beloved Holistics. I do take one-on-one clients from fertility all the way through postpartum and even a couple menopause patients or clients. And then on Instagram and all the socials, it's Nathan Riley, OBGYN. You can find me in all those places, and I hope people will. I hope you guys will come and say hi. Tell me if something landed for you and let me know how I can support you.
Fantastic. And I'll make sure the details are in the show notes as well.
Yeah, that sounds great, Leigh. Thanks again. I appreciate it.
Nathan, I've absolutely loved this episode. It's just been fantastic.
Yeah, it's I always love speaking to people like you because you have this like real understanding. Like I don't actually have to, like I can go a little bit deeper because you have like a true understanding of what holism means. I mean, it's right here on my shirt, holism. You have a true appreciation because of your proximity to the teachings of at the Czech Institute and Paul and Angie and there's so many practitioners out there who don't even have that foundational sort of the foundation sort of in place. And then they start doing the functional medicine and all this, and they forget that like this just starts with basic stuff, guys. All of that other stuff that I've got training in and that you've got training in from functional labs to even biogeometry and anthroposophy and all this stuff, like that's extra. If you're not eating and moving and sleeping and all that stuff, we can't polish a turd, as the old adage goes. Like we got to start with a rock solid foundation, and that goes for fertility, pregnancy, and beyond. So it's always a pleasure to chat with people like you because you guys really get it. So thank you for doing the work you do, and for those listening, keep it up. Like you're on the right path if you're listening to this podcast. I mean it.
Yeah, and I have got some amazing listeners to this show. So yeah, I think you're right with that.
Yeah, right on, brother.
Awesome. So that's all from Nathan and me for this week. But don't forget, you can join me same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.